Happy New Year, everyone. My name is Erica Ninoyu, and I serve as Senior Advisor to the White House Initiative on Asian Americans, Native Hawaiians, and Pacific Islanders, or what we call WHIAANHPI. Last August, WHIAANHPI was proud to launch Demystifying Federal Grants, a webinar series developed with our partners at the National Science Foundation and the Asian American Foundation to help community-based organizations prepare for and apply to federal grants and funding opportunities. Thank you to the nearly 900 community members who registered to attend our first webinar, and for hundreds of you from across the country who are taking the time to join us here. Building on the Biden-Harris administration's efforts to bolster technical assistance outreach to underserved communities, today's webinar is focused on federal grant opportunities at the U.S. Department of Health and Human Services. In May 2021, President Biden reestablished the White House Initiative within HHS, where it was first created under the Clinton administration. And with the leadership of HHS Secretary Javier Becerra and U.S. Trade Representative Ambassador Catherine Tai, WHIAANHPI has been driving a whole of government agenda to advance equity, justice, and opportunity for our diverse AA and NHPI communities across the country. We recognize that COVID-19 pandemic disproportionately impacted the health and economic well-being of our communities, including exacerbating long-standing disparities. And the pandemic era spike in anti-Asian hate and the epidemic of gun violence that we continue to see today have also had a devastating impact on the mental health of AA and NHPIs, providing new urgency in our work to improving access to life-saving support, including culturally and linguistically appropriate health services. Under the Biden-Harris administration, we're working to improve the equitable allocation of federal resources, including contracts, grants, and awards, and to eliminate institutional policies or barriers within federal programs and services, which may burden our communities. We know that trusted messengers like community health centers and healthcare providers in our neighborhoods are critical to delivering information and resources in linguistically and culturally appropriate ways. This includes critical help to ensure individuals have healthcare coverage through renewing or enrolling in Medicaid, the Children's Health Insurance Program, CHIP, or marketplace coverage. Today's webinar is our next step to sustain efforts to advance health equity for some of our nation's fastest growing populations. And we hope you'll leave us more knowledgeable about the opportunities and resources available to you, and that you are better prepared to compete for federal funding. I'm grateful to our co-hosts and the National Science Foundation and TAAF, and to representatives from HHS for joining us today. And to all of you tuning in, thank you. This work cannot and should not be done alone. Whether you are a community member, nonprofit, and business leader, or involved in philanthropy, please know that you have partners in the federal government and that we deeply value your insight and feedback. Now, I'd like to pass the floor to Audrey Yamamoto, COO of the Asian American Foundation.
Thanks so much, Erica. Hello, everyone. As Erica mentioned, I'm Audrey Yamamoto, the COO at the Asian American Foundation, also known as TAAF. And we're really honored to be working with WHIAANHPI as well as the National Science Foundation to host this webinar series. It's really designed to be able to help more AA and NHPI nonprofits to unlock federal resources. In addition to this webinar series, or as part of it, we've also compiled a list of current federal grant opportunities that anyone can view on our website at taaf.org. We'll drop the exact website link for you to check out in the chat. Before we start today's session, I'd love to share a little bit more about TAAF and why this webinar series is so important to us. We launched in 2021 in response to the historic rise in anti-Asian hate with a commitment to building a safer, more inclusive future for all AA and HPIs. Our work is centered around 4 core pillars: anti-hate, education, narrative change, and resources and representation. Resources is a core pillar because we know that less than 0.2% of philanthropic funding has been going to our AA and HPI community, a shocking statistic that was shared but in a study from Asian Americans and Pacific Islanders in philanthropy. So because of this, one of TAAF's key goals is to reverse the long-standing underfunding of our community. In addition to this webinar series, we're doing this in a few ways. Our API Giving Challenge, which is where we've invited partners to commit funding and in-kind support directly to our community over 5 years. Our portfolio strategy that invests in organizations across the country and builds key initiatives that support our core pillars. And also the API Nonprofit Database, which is an interactive tool to drive more support to nonprofits across the country. Many thanks again to WHIAANHPI and National Science Foundation for your partnership in bringing this webinar series to life. We truly hope that the insights that you gain from today help you to better access critical funding opportunities. Now, without further ado, I'm pleased to introduce two of our expert presenters for today from Workspace, Sagal Musa and Ratna Gundalpet.
Good afternoon, everyone, and thank you for joining the Grants.gov Workspace overview. My name is Sagal Musa, and I'm a program advisor at Grants.gov. With me is Ratna Gundalpet from our business performance systems. Our hope is that we can answer your questions at the end of our presentation. So we appreciate your feedback. So please add your comments or questions in chat. Next, please. Agenda. I will talk about the list on this slide today. I will be covering what's Workspace, the flow, the roles, the progress, the various tabs, and submitting application in Workspace, and how to get help using Workspace. Next, please. What's Workspace? Workspace is a collaborative online space where members of a grant team can access and modify various forms within an application. Several team members can access the Workspace simultaneously to collaborate, complete, and submit the application. Next, please. The Workspace flow. This infographic outlines the application workflow for applicant organizations. To create a workspace, first you must be registered in grants.gov. Getting started, a core role or a custom role with the Create Workspace privilege is required to create a workspace. Add your team members. This feature allows the workspace owner to add participants from within or outside the organization. They can also assign form access and reassign the workspace ownership. Completing your forms. This phase is of the infographic shows how a participant may opt to fill out application forms. They can use the PDF files, which are offline, or web forms using filling the forms online. Completing your forms. This phase also shows how the participant might be asked to fill out the forms. Submitting application is the last phase of this workflow. This infographic provides details on how to submit your application. And any participant with the submit application for my workspace privilege or organization users with the submit application for organization workspace privilege is able to submit the application. This more information about this infographic here, you can find on the link on the screen. Next, please. Workspace roles. Workspace roles, users' privileges in Workspace are determined. They're assigned roles to create Workspace or access from data. Any user with the expanded AOR role can manage all applicants and workspaces for the organization. They can also assign roles, create workspaces, and submit any workspace application. the standard AOR role, for example, users with the standard AOR role can create workspaces, submit grant applications, and also assign and manage workspace role. The workspace manager can create workspace for a specific funding opportunity and also serve the workspace owner. These are the core roles of grants TAAF to create a workspace. To learn more about these workspace core roles and understand the functionalities associated with each, please visit the link above on this screen. Next, please. Workspace progress. These 5 phases of workspace in the Manage Workspace page, you can see the workspace progress bar, which shows participants where they are in the process when completing a workspace application. The first step is to create a workspace. Again, having a grants TAAF is required to create a workspace. After creating the workspace, filling out the mandatory and optional forms is required. The optional forms that are required by the agents. Then informing the AOR when the forms are successfully completed. Next is submitting the workspace. Then the agency sends a receiving confirmation. The application is being received. Next, please. Manage workspace. On this page, you could see a list of tabs, including the Forms tab. The Forms tab lists different forms requested by the agents. It displays both the mandatory and the optional forms. If you look at under the Actions column, we can see various ways when filling a workspace. You can download the PDF form and complete it offline, then upload it back to the workspace. This feature is helpful for participants experiencing potential connectivity issues. The reuse option also is useful, where the participant can use forms from previous workspace. Forms can be filled online by clicking the web form under the Actions tab, or clicking the link under the form name. Forms can be locked to prevent participants and other collaborators from making updates while the form is being filled. Locking the form also prevents any accidental data overwrites while someone is working on the form. Next, please. Reuse forms also can be used to have another form from other workspaces, previous workspaces. A few tips to remember when reusing a form from a workspace: you make sure that they'll be the same name. It works with the other versions of the form. Also, when a form being reused, data and attachment in the form are copied to the new destination, and the workspace is not altered. Other forms will not be changed as well. Next, please. This screenshot shows what the online web forms would look like when the applicant is filling forms online. It highlights where you are in the application, filling the form. It has an easy navigation you can jump any section that you want to fill and come back. It also have a check errors feature where if you have any errors made, you can see it. Also, it runs a validation check that highlights all the errors that must be corrected before submitting an application. Next, please. Manage workspace, view application tab. This application tab allows you to see submitted application. You also have the ability to download the application or view, simply view. If you are not authorized to view the application or download, you can only see the application names and form names as shown on this table titled application forms on the screen. You can also access the online user guide that will take you any question and all the relevant articles. If you are stuck on the workspace or not sure sections that you're filling, if you see the question mark on the screen, can take you different articles that will help you to go through the application process. Next, please. Manage workspace. The attachment tab also enables you to view and download attachments associated with the application. Attachments in PDF formats are available to download. Next. Participants tab. It allows you to see the information regarding the participant, basically the contact information, names, username, the phone number, and email. Note, if you are not an individual applicant, you will not see the participant tab. Adding participants from a workspace organization button will allow you to search among organizations' registered users. Adding participants by username or email will allow you to search participants among all users, including those who are external to your organization. You can only add one user at a time if you use adding by participant or username. Next, please. The activity tab shows the activity tab provides record of the workspace forms and participants. This helps to track actions such as forms, saving. Also, it shows if the form is being locked or unlocked, or when it's locked, it has the time, if you can see on the screen. Also, it shows if a participant was added into this workspace, also it will show under the actions column on this screenshot. Next, please. The details tab is very useful. It provides about the submission, and you have the option to download the submitted application package if needed. Also, this table contains information about submission made within this workspace. It also shows that the tracking number is very useful tracking your application. Next, please. The submit button will be prompted to answer the question when you have finish the application and click the sign and submit button. You will have a question showing on the screen that will say, is this a change or corrected application? If you select yes, you are resubmitting this workspace. This will associate the new workspace with the previous, and the tracking number will be on the screen. And if you select no, the submission will not be associated with any other application. And then you click sign and you put your password, and that's the end of the submitting the application. Next, please. After you submit the application, you will have a successful confirmation page pop up as displayed on this screen. It will have information to track your application. It will give you a grants.gov tracking application. Some agencies also send you another tracking from agency specific tracking number with the date and time received also showing on this successful submitted application. Next, please. This slide summarizes the stage of the workspace submission progress and the functionality. You have to create the workspace, having a funding opportunity. Then you add if you would like to add the participants on your workspace, you complete all the application forms, you check for errors and track application. And then that's the end of the presentation of the submitting application. Next. If you have any questions, we have the grants.gov Applicant Support Center, which can be reached at support@grants.gov. You can also use the self-help support listed under the online help feature, which also includes a series of YouTube tutorials. Also, you can subscribe to the grants.gov blogs and newsletters. Next. These are the various ways to get in touch with grants.gov using our YouTube videos. You can reach us if you have any general questions. You can contact us at community@grants.gov. For specific questions related to workspace application process, you can call the support center also, and you can email them supportcenter@grants.gov. And the YouTube video tutorials are very helpful, and they have they're not very long, but they're a list of series of you can follow along. Also, the online user has a lot of information as well. And that's the end of our presentation. And thank you for your time. If you have any questions here.
Well, thank you to Sagal and for the presentation, and it was incredibly important. So for folks who are on this call and you're wondering why you're now seeing my face pop up, my name is Sam Hyun. I'm the Director of Government Relations for the Asian American Foundation. And I am actually on now to take us into the next portion as we're trying to stay on track. So we're actually going to conclude that last section, but also, really fascinating to kind of hear what HHS has to say in terms of that new program they're rolling out. Given that, I'm extremely grateful to be able to announce the next 3 panelists. So I'd first like to introduce Jacqueline Branscombe from the Notice of Funding Opportunity Branch, Chief at the Office of Grants Policy and Administration for Children and Families. And then next is Jamie Leger from who's the Acting Director for the Office of Grant Services, the Office of Financial Resources in the Centers for Disease Control, otherwise known as the CDC. And then also finally, last but not least, Holly Rogers, the Supervisory Public Health Analyst at the Office of Financial Resources in the Substance Abuse and Mental Health Services Administration, or otherwise known as SAMHSA. So welcome to you 3. Thank you for joining us. To be able to have all 3 of your expertise here to walk us through what you do and provide these incredibly important resources. We're really, really grateful. And to kick things off, just to kind of dive right in, could each of you, starting with Jacqueline, please briefly describe your agency and what type of grants that are offered, further including the grants that might pertain to the AA and NHPI serving organizations.
Thank you for having me. I'm happy to be here. I attended the August panel, and I was really excited to be asked to be a part of this panel about demystifying grants. So the Administration for Children and Families, that's the agency I'm a part of, is an agency within HHS. Our mission is to foster health and well-being by providing federal leadership, partnership, and resources for the compassionate and effective delivery of human services. So we have over 100 programs within ACF. You might have heard them, things like foster care, child care, Head Start programs. A lot of them exist within ACF. We have a budget of more than $70 billion, and we're the 2nd largest awarding agency within HHS. In terms of the types of grants that we have about 40% of our awards are given to states. That's because we have a lot of awards that are non-discretionary, which means they're formula or mandatory or entitlements, so they go to the states. However, we have over 40% of our funds that are given out as discretionary, which are the ones you're probably interested in. There's a list that I saw on the TAAF website, but that's also coming from our grants.gov site. So you'll be able to see a lot of the competitions there of different types of grants. We currently have about 51 opportunities listed on grants.gov. They're forecasted. That means they're not in competition yet, but that gives you a good idea of what's to come. And there's also going to be some more coming in the near future. So that's in terms of items of grants that might pertain to WHIAANHPI organizations. I saw on TAAF, you guys found some on there, like the ANA. We have a couple from the Administration for Native Americans. We have a couple from our Office of Refugee Resettlement. So be on the lookout for those. We don't necessarily fine tune all of our program funding opportunities to specific groups, but all organizations are eligible to apply. So highly encourage that, even though it doesn't say AANHPI, to still go for it. So that's my quick spiel there.
Thank you, Jacqueline. And Jamie?
Sorry, I was slow to unmute myself. My name is Jamie Leger, as noted earlier, and I'm with the Office of Grant Services at CDC. And CDC, in a nutshell, is public health. You know, that's our mission, is public health. We have 1, 2, 3, 4, 5, 6, 7, 8, 9 centers that each have multiple grant programs that the intent is to have the impact on public health. We've got immunization, HIV, viral, STD and TB prevention, infectious diseases, chronic disease and prevention, birth defects, environmental health, injury prevention, and occupational health and safety. And we also have a fairly large global portfolio. And we post about 120 to 130 NOFOs each year. Like Jacqueline was saying from ACF, the majority of those for us are full and open. Some of them target state health departments or state health department organizations within the states, but not all, and just about anyone is eligible to apply for those. We only have 1 or 2 mandatory programs, and the rest of our programs are discretionary. Our budget isn't quite as large as ACF. We have obligate about $11 billion a year in grants. We usually have about 5,000 to 6,000 grants a year that we're administering to just a little over half of that number. And again, for the majority of those programs, they're open to the general public. One of the things that, and I may be bleeding into the next question, I'm sorry, but it's in my thought process right now. So if I'm getting ahead of myself, one of the things we are doing to ensure that more organizations and entities that might be eligible or, see, read, notice, and are able to apply is we're working with HHS on what we call a simpler grants notification process, to where we're trying to make it easier for any type of organization to see and understand that they are eligible and to be able to respond to those NOFOs. And we're trying to increase our reach in the communities and broaden that reach. So with that, I'll stop right there and pass it over to the next person.
Thank you, Jamie. Holly?
Great, thank you. So as mentioned, I'm with SAMHSA, the Substance Abuse and Mental Health Services Administration, and we provide grant funding to states, territories, tribes, and local communities for programs that improve lives of people with or at risk for mental health and substance use conditions. So our programs, we have some forecasted as well. I think it's about 30-ish, give or take, this year. We also have formula grants, but I'm just only going to really focus on the discretionary programs. So the mental health programs focus suicide prevention. This is just some of the topics. We have a variety of programs depending on the year. We offer opportunities. Children's mental health, peer support, treatment for children with serious emotional disturbances, homelessness, supported employment, trauma. And some of these grants are for training and technical assistance. We also have prevention programs. So that really is prevention of underage drinking, substance use, HIV, and harm reduction, as well as treatment programs that could focus on things like drug court, reentry, recovery support services, homeless, and treatment for substance use and co-occurring. And we have some residential programs and some opioid overdose and opioid abuse. Some of those as well focus on some training and technical assistance. So those are some of the opportunities that SAMHSA has, and we also have those forecasted. We have a few open right now, actually. So that's on our SAMHSA grants page, as well as in grants.gov. But on our SAMHSA homepage, there's a grants area, and on that grants page is where we have both the forecast and anything that is currently open.
So sticking to, we're actually going to stick with you, Holly, for the next question, which is, can you walk us through what the grants process like is for your agency? I think for a lot of folks, it'd be really helpful to be able to just, we were talking about demystifying, but just like, what is the process for folks who maybe never engaged before?
Yes, of course. Thank you. So this is just a very high level kind of overview, right? To really get into the nitty gritty, it would get pretty deep. So just as an overview, our process, we put out funding opportunities, right? So we announce programs that we're going to fund in the current fiscal year. And those are posted, as everybody else's are, on our webpage and on grants.gov. And once the applications are received, they go through a peer review process within SAMHSA. And then we fund applications based on the amount of funding we have for a particular program. So that is listed in the notice of funding opportunity. We put the approximate amount, it's estimated, it could go up or down a little bit depending on other things that happened. And most of this information, as I said, is in the funding opportunity. And then we award grants based on the amount of funding that we have. So we have to fund the applications no later than September 29th of the fiscal year. So that's kind of a high level overview of how we fund the grants.
And given that, I'm sure a very similar process for the other agencies here, I'm going to actually kick it to Jacqueline for the next question, which is, what are some of the technical terms that applicants should be looking out for, right? And like NOFO, for example, is a good one that gets tossed around, I think, a lot by agencies, but I think if you're engaging, you may be a little intimidated. So are there any other terms that come to mind that folks should know and be aware of? And I think this goes to Holly and Jamie as well, if there's any others that you think of that Jacqueline doesn't since I just put her on the spot.
Yeah, no, it's a tough one. It's hard. Like if I've been living this world for like 10 years or more, like I feel like it's baked into my brain. But obviously, if you're new to this, hearing acronyms, it's a lot. So NOFO is actually kind of new for us. There used to be FOA, now it's NOFO. Notice of Funding Opportunity is what we call it. But you might hear it called something else at different agencies, like a funding opportunity announcement or a NOFA or something like that. But they're all the same thing. They all appear on grants.gov. For ACF, we were thinking about this and we're trying to help our applicant community and our recipients as well in terms of our various terms and conditions, different terms and words and keywords. We actually developed an ACF, we have a grants website now at acf.hhs.gov/grants. And there's actually a glossary there that kind of takes in a combination of terms that you might hear that they come from various grant regulations, like you might hear 2 CFR 200, or you might hear things like that. If you go, like I know our site, our agency has a glossary. I think some other agencies do have some other terms as well listed. I would recommend taking a glance there and trying to see what those various terms are. Our goal, kind of what Jamie was saying, we're trying to make it easier for folks. So we're trying to make sure that we define any acronym or any word that doesn't make sense. But definitely, if you have questions, to reach out to any of our contacts.
I'll just add for CDC, same thing. We're acronym heavy. I think that's the federal government. We have a website called it's www.cdc www.gov.//grants. And on that, that's a link to like Grants 101. And there's a lot of information and links that help a new entity or a new organization who's not familiar with, the federal grants process on how to get started, what to know, terms and conditions, and again, a glossary. I think that's a very helpful website for beginners, beginners, and if you're not a beginner, because that information is always updated. I can't think of any additional terms, but I'm sure there's information on that webpage that would answer a lot of your questions about, terms related to budgets and applications that you submit, terms related to the work plans that are going to be submitted with the applications. It's again, that's if you go to that website, it's a very useful website with a lot of links and a lot of information.
I just want to add that SAMHSA developed a manual called Developing a Competitive SAMHSA Grant Application. And in that manual, it basically answers all of the questions that you could think of for first time or for anyone. It's a very useful tool. And that includes a glossary and acronyms and, common terms. And that manual is on our website on SAMHSA. It's under grants with the subheading under grant materials. And that can be downloaded. And there's also some links of other things that are helpful for applicants that describe the process. But that manual is one of our best resources when submitting apps to SAMHSA.
Thank you. And so, I think that last resources that you provide is incredibly important, but also, do each of you have any like immediate tips, right? Something like really quick to be able to determine whether or not their organization might be a fit for this grant, or would they be competitive? Is there any way for them to be able to determine that aside from, just doing the due diligence, right? Like a lot of these organizations have a lot of things on their plate. So like, how do they determine whether or not this is worth applying for?
I will start out by saying, there is nothing wrong with when you see something announced, a NOFO announced, there's always some points of contact listed. We're always open to questions and comments and concerns. I will just preface that by saying, or caveat that by saying, any specific information that we provide related to the requirements of the NOFO, we may have to publicly post, but there's always a point of contact you can reach out to for questions. Another thing I will say is in a lot of our NOFOs, if it's a fairly new program, or if we know we're trying to target a new audience that we haven't been able to reach before, we usually include a webinar pre-application submission webinar, and that's an opportunity for you to ask a lot of those questions and make determinations about whether or not your organization would be a good fit. So I would definitely just say use the resources that are at hand and don't be afraid to reach out.
Yeah, if I could tack on just a couple of questions to make sure you ask yourself when you see these forecasts. The forecasts we say forecast, hopefully you guys understand that what that means. We post up a kind of a quick description of what is to come, of a competition that is to come. And in that forecast on grants.gov, we list out various organizations that are eligible. So make sure that you are actually eligible for that NOFO. A lot of times there might be something that sounds great, but only states can apply. And the reason why some of these eligibilities are set that way is because it's the way it's written by Congress when they gave us the funds to give out. So we're kind of limited by that. So that's kind of one thing to make sure is are you eligible? Another thing is just to make sure, check out those deadlines of when the application is due. Do you have the time and ability to actually complete the application in time for that? Sometimes these NOFOs include requirements that mean like you have to get a letter of support or get a term of like some sort of agreement with someone, and make sure you have that baked into the amount of time that you have. Another thing is when looking at the NOFOs, not all NOFOs are the same and all different programs are different. So you want to take a look and see if your organization has the technical expertise or the personnel or even the financial capacity or the capacity to handle some of this administrative requirements that are in there. A lot of times our NOFOs list out what is required when you become a recipient. These are the things you must do. So take a look at what's listed there before even considering, hey, can I even if I got the funds, would I be able to even carry this out? I think if other items, those are the main ones I can think of. And just making sure, I would still say go for it. Like just look at the eligibility to see, but still like just err on the side of, well, let's try it. I know that there are a lot of work up front, but it might be worth it. So, yeah.
I would just add also to the point that everyone has made, we obviously have contacts in ours as well. So please reach out. We do pre-application webinars, FAQs. But once you look at something, or even if it's forecasted that may be coming in the future, and you think, well, maybe I could do some of it, but maybe I'm not in a position to do all of it, that's an opportunity that you can start thinking about partnering with other organizations and, you know, being able to be part of it without being the entire entity. So can you actually effectively implement what is required? And if not, maybe you can actually partner with another organization and doing it, or, you know, multiple doing it together. You can actually, you know, be part of that.
Yeah, I think that actually answers Bhavana's question in the Q&A. That was about like organizations, small organizations that can't, if they can't do it themselves, can they partner with other folks? That's definitely a plus for us too in ACF.
Right, and developing relationships with your elected officials so that they're able to write letters on behalf and advocacy. My previous role, I worked for the city of Boston doing federal relations, so there's a little bit of you know, so that being said, and having made some of these mistakes myself, what are some common mistakes that occurred during the process, and or, you know, that you can think of that are that might be easy to overlook, or just, you know, roadblocks that just come that aren't expected?
Well, I'll start again. One of the things I would say is when the notice of funding opportunity announcement is posted, make sure you do read through the entire notice of funding opportunity announcement, because there are one of the most common mistakes, and this is still going to be a little bit general, is missing something that is in the NOFO that might to how your application is going to be viewed. So make sure you read and understand the NOFO completely before submitting a response. That's one thing.
One thing I would say for also is make sure you register for grants.gov and register for sam.gov well ahead of time. A lot of folks, they have a great application ready to go, but they didn't get the registrations in place in time. And so some of these registrations take a few days. So definitely getting that registered right away. And another one that is kind of similar to what Jamie was saying is looking at the formatting requirements. Sometimes people get tripped up and not realize there are formatting requirements when you write up your narratives. If you, for example, didn't follow like the font or the margins or something like that, it could result in your application getting cut like partially. So some of your information might get lost just because the formatting didn't match what was requested. So that's kind of something to flag.
I would also add that it's not just the system for award management, grants.gov. So yes, you should do that as soon as possible. There's also the ERA Commons registration, which we also need to have at least at SAMHSA. And so that is important to have that done, but also making sure that because of that, that you get your application in at least a few days prior to the due date. And so you're aware of when the due date is, you get the application in. So in case there are any errors or anything that is preventing the application from going through the process, that you'll be able to correct those issues prior to the deadline so that you can actually meet it. So that is one of the most common mistakes that people make, is that just submitting it so close to the end that you end up not getting it in. And at SAMHSA, there's a guide that goes along with the applications or appendices, depending on, and we list common errors that happen when people submit. And so that's something that's useful, and how to actually correct those errors.
See, that's advice I could have used when I was a student in terms of not waiting for the last second to do my work. Oh God, my teachers would probably be rolling, laughing if they heard me say that. But for the purposes of our attendees here, how much preliminary work should applicants do before applying for a grant?
That's a tough one, because I feel like it depends on what it is that they're applying for. Make sure that, well, and I'm going to go back to make sure you read it thoroughly and understand everything thoroughly. Make sure your organization structure, you've got that clearly identified, and who, what, where within your organization will be performing the activities, or if you're going to partner with someone, what that partnering looks like. But I think that's a tough one, because it really just depends on what it is you're applying for. You just need to be prepared.
I would say right now we have opportunities that are forecasted. So one of the things I would highly recommend, if any of those kind of makes you think, oh, I really want to do this, to definitely go to our agency. We have a website, have all the different program offices listed. Some of these opportunities that are posted have been posted in the past. So maybe you might want to take a look at previous notice of funding opportunities to get an idea of what might be included in an application. A lot of times in these forecasts, there's also contact information. You could contact someone in our agency to ask other questions, but definitely kind of doing that research and getting a feel for what this program office would expect. Also in our ACF site, we have that grants page. So get an idea of what might be required of you as a grant recipient, what kind of, what do the reports look like? What do all these different things look like? So kind of like even though there's nothing, the actual competition isn't posted yet, there's still a lot you can look at in terms of just the program in general. And if this makes sense, and maybe you could get creative, like, oh, how would our agency be able to do something interesting that's different that might be helpful. So, yeah.
And Holly, I don't know if you're going to go, but I was going to jump in and add one more thing tied to kind of what you were saying, Jacqueline. We've got our grants one-on-one page with a lot of resources. Go to that now as soon as you can and start clicking and pointing through that information. Is going to be helpful. And also on cdc.gov, you can click to a page for each one of our different programs that we have and learn more about those programs and what they do. I think that'd be helpful when you're applying for a NOFO tied to one of our, centers and institutes. That'll help you be prepared to just understanding more about what the agency does if you're new to applying for a grant with CDC or the Department of Health and Human Services.
I would only add that SAMHSA, you can submit a Freedom of Information Act, a FOIA request, and ask for application and applications, or a couple applications that were funded from an announcement that you are interested in. And there's no fee to do that, and you can submit that request on the SAMHSA site. It's on the homepage. You can scroll all the way down, and there's a Freedom of Information Act, or you can just put in the samhsagrants.gov page, a search on the homepage, and put in FOIA, FOIA, and that will take you to the information to be able to request that.
Yeah, and in the interest of time, I'll also add, in my experience has been, even when you apply for a grant and you aren't awarded the grant, the various departments and agencies are more than willing to have a conversation with you and kind of walk through, like, as much as they can disclose why you were not successful, and so you can prepare for maybe next NOFO or next opportunity where that grant is re-released, and at the very least be able to learn, and folks are super kind and willing to be helpful, and they're trying to help you. They're not trying to work against you. And so it may seem intimidating to try to engage with the federal government, but I can assure you that the folks are really kind and want to help you navigate through the really difficult waters of these grants. As we close, for each one of you, I would ask that you take like 30 seconds to a minute to have maybe some last words of advice or encouragement, anything that you would want to share with the group before we conclude this session today.
I would just say, anytime you see information tied to webinars and information sharing and listening sessions, which is another thing that CDC has begun to do often, sign up and dial in. Share your information and your questions.
Yeah. I would say that although in the NOFOs or in the forecast, we don't say specifically WHIAANHPI organizations, or specifically, maybe you might think, oh, my organization is very specific. Nonprofits, we don't award to individuals, so all of ours are like organizations or entities. That means you, if you're one of those organizations, and so feel free to go ahead and attack it. But also, in tying to what Holly was saying and what the question was, like, if you feel like you don't think you can handle this award alone, take a look back on the HC website, see who applied before. They might be applying again, and maybe you might want to partner with them and see if you can make that happen. There are ways into being either a grantee or a sub-grantee. So it's definitely worth taking that shot.
I would just end with make sure you get your application in time, a few days prior to the due date. And I would say that there's an evaluation criteria. It's section A, question 1, and here's what it is. And the narrative should basically match up with every single, that's the easiest way to make sure that you are responding to every single element that is included in any NOFO, and making sure that you have all of the attachments that are required so that you're not screened out for missing something silly, and as Jacqueline had mentioned, the font size and that type of thing, but making sure that you look at the narrative, the evaluation criteria, and line up your narrative that way. That is so that nobody misses anything. Reviewers can see exactly what it is you're responding to. That's it.
Amazing. Well, first of all, just a massive thank you to Holly, Jacqueline, to Jamie for joining us today. I also would like to thank, obviously, well, it's kind of weird to thank myself, but TAAF, NSF, and WHIAANHPI in the Biden administration. And also to all the folks who have joined us today, thank you for joining. This is incredibly momentous, where we can really start to demystify these federal grants and realize that we have absolutely every right to ask and go after and receive funding from the federal government so that we can really build and work on behalf of our community. So on behalf of TAAF and NSF and the Biden administration, thank you for joining us today. Thank you all for doing the work that you do each and every day. And we are a better community and we're a better country for all the work that you do. Thank you.